So we're back to put a little bit more filler in. As we did last time, we filled into the hollow here and over here. And of course, with the darker skin here and the lighter skin here, you're always going to see a hint of a hollow. So what we'll do today, Rick, is we'll be a little bit more aggressive with filler here because we've done it the once and you did great. And we'll put a tiny bit here because I can only fill that hollow so much, and then when you smile, it won't look normal. And so we'll put quite a bit in the outer hollow and a little bit in that inner hollow. I'm going to mark the other side too. And this little pooch right here we talked about, I can't get rid of without surgery. That's the little bottom of what you think to be the bottom of the muscle. And so some people think you can fill above and below it and make it go away, but then it just looks puffy. So this little pooch here, the only way to really fix that is to pull the muscle and skin up like that. Okay, so we put a small drop of local here just for this needle stick because we use a blunt needle for the filler around the eyes in most areas unless we're a little lower. So I'm just going to gently put this in here, Rick. You shouldn't really feel any pain if you do tell me. And this is just our little pilot hole just to kind of allow us to thread our blunt needle in. Blunt needle slides in, so Rick, you know, you'll feel a little weird feeling. It's just pretty normal, okay? Kind of hang in there with me. And so we're very gently threading the Restylane into the tear trough area. And usually it's just a weird sensation. Is that accurate, Rick, or is it? Of course, like I said, us men are much worse than women, so we take everything harder, but that's okay. It's just the way it is. You're doing great. Done with that, we filled the inner layer of the inner tear trough from there to there to fill in that hollow. And then now we're going to put a little bit on the outside. An alcohol sponge, please. Thank you. And so here we go on the outer part. Again, we're threading our little needle in here. And you'll feel a little bit more pushing and pulling because the tissues on the outside are a little thicker. So kind of hang in there with me, okay? And again, we're putting very gentle pressure on the syringe when we inject this so we don't put too much pressure that could push the product in a place we don't want it, like a blood vessel. And we believe this blunt needle certainly makes a difference as far as any risk. It certainly makes a difference as far as bruising. Okay, so we're done on that side with the blunt needle. We will use a sharp needle in a few seconds just to fill up right on the bone because we can't get that close with that. So that you did great. I hope that wasn't too bad. Look towards me now and open your eyes. Great. So you can really see the difference. If you can turn this way, you can really see the difference of the hollow here versus there. You see how deep that is versus this. And again, this is the second time we've done this because we would rather be conservative and go gradual than to do too much. And again, what we're using is Restylane, so it is a product that is dissolvable in the event that we needed to take some out. So anything we use around the eyes that is permanent, I think in general is not the greatest idea because it's not very forgiving around the eye with something that you can't remove. Okay, thank you. All right, here we go on this side, Rick. You shouldn't feel anything. Tell me if you do. And again, that's our pilot hole. And this is what it looks like. You can see that it's just a clear gel that we're putting in there. And the way it works is it puffs up the area by pulling in water in the area, and hopefully lasts for up to, around the eyes it can sometimes last more than a year to year or two because there's not a lot of motion there that gets in the way. Here we go, Rick, you okay? A little pinch here. And again, it looks like I'm hardly doing anything, and I'm going very slow and putting very small amounts in. We know this works because when we do eyelid surgery on people who've had filler, you always see the filler. It looks just like a clear gel, and there's nothing wrong with it, except that at some point the filler doesn't accomplish what you want, and you wind up, if you want any further improvement, having to do some kind of surgical procedure to make it look right. So that's why we know kind of how that looks in the tissues. And here we go at the top. Okay, so it kind of feels weird. It's kind of a lot stronger tissue here on the outer part. There we go. Okay. I'm tapping on you because it feels weird. And it feels like I'm coming right at your eyeball. I promise we're not. It just feels that way. Just going back and forth, just gradually laying this in there very gently. Very little pressure. Alcohol sponge, please. I'm just going to reassess before I either put any more in or stop on that part. Okay. Typically divide the two sides evenly, but sometimes one side needs more than the other. This is just one side that looks a little deeper to me. So we're putting a drop more on this side. I'm going to sit you up for a second. You just look at everything here. Okay, and lower your head just a bit. There you go. So remember, this swelling is something that was a normal pooch, and we put local there, so that's not our concern. You have a Q-tip, please. Really good. So we've basically filled this entire area, and this is swelling and a malar pouch that we can't fill. So and give me a big smile now. Yeah. So we need to put just a little bit there, and marking pen, please. And one more time, smile. Perfect. So there's no distortion when you smile, which is key. Okay, maybe sit back and we'll finish up with the filler, and we'll be done. And this part we put right down, which is very safe, right on. Do you have pain there, Crick?
No pain.
It should be pretty numb from the local we put in. Just a little bit more pinch right there. The impulse is to keep filling and filling, but at some point it just doesn't look right, so you can only fill so much. And of course, you want it to be subtle enough that no one really knows you did anything. They just say, well, you just look more rested because you don't have as much of a hollow. And again, in your case, because of the dark skin, which is genetic, you can't really get rid of that. Okay, Rick, you shouldn't feel this because it should be pretty numb, but if you do, let me know. This molding really doesn't do what you might think it does, which is move it around. It just makes sure that it's as smooth as it can be, but you really can't move the product very far once you put it in. Okay. Sponge. Put a little antibiotic ointment over the tiny, tiny needle stick. So I'll give you that mirror, Rick, so you can see what we did. So if you hold that mirror in a second. So what we did is we put, you can see this is the local anesthetic bulge and the natural bulge you have, which I can't do anything about. We filled all of this. You're already starting to get a little bit of a bruise there. And if you look on the other side, we did the same thing. So again, when this goes down, which is artificial, it'll look a lot better. So you did great.
Yeah, it looks good.
Yeah, so hopefully that'll be just enough to make a difference. That basically, doing it in stages, the first step and then the second is better than putting the same amount in at one time. Thank you very much. Appreciate it.